Of course, there are so many restrictions and directions during the period of treatment. And if it is a general healthy oriented procedure, this will be more important. Anyway, the whole Panchakarma or any Panchakarma, if it is a single one also, has some Purva Karma, that means to be maintained before starting the actual treatment, actual procedure, that is known as Purva Karma. And then comes the main procedure, that is the main Pradhana Karma. In Ayurvedic term it is Pradhana Karma. Then after the procedure also some factors are to be followed, that is known as Paschat Karma, aftercare. All these three are equally important. This is not only in the case of Panchakarma, any disease, any treatment it is necessary, because there are some trigger factors for any disease. We have to avoid it. Anyway, in the Panchakarma, these procedures are highly scientific and it is acting upon not on a single point, but it is acting the whole body. So, they should have one suitable situation or an environment to act upon. So, that should be created. These all the restrictions on food habits and other factors are to create this environment. That is what is meant by these pathyas and apatyas like that, which is suitable and which is not suitable. So, that varies from one procedure to another procedure. We can also say indications and contraindications also comes under this particular factor. So, for example, for Nasya, we have to keep on some certain food items, so that the action of Nasya will be more effective. Or we have to keep on some factors, it will be some habitual or dietary etc., to keep on the result for a long time, or to bring back the body to its normal situation. So, that is known as these restrictions. It is not a particular thing for all the people, because people are of different body constitution. According to Ayurvedic theory, different dosha prakriti and its combination, maybe Vata dominant patient, or maybe Pitta dominant patient, or Kapha dominant patient, or the combination of one or two, or all the three. So, we cannot say the same restrictions to all the people in the same way. It also varies from one prakriti to another prakriti, and it also varies according to the age of the patient. We cannot say the same restrictions to a 25-year-old youth and then 75-year-old senile patient. So, there also it varies, and we cannot say the same thing to diabetic patient and also to hypertensive patient. So, it varies. Anyway, restrictions are absolutely necessary. Only thing is it varies from one person to another person, and some common features are there for doing Panchakarma, which will be very common for everybody. That is some food restriction. We cannot eat that much heavy food items, because we have to consider Agni. Agni is another concept in Ayurveda. Anyway, restrictions are there. It is absolutely necessary during the period and before starting the period and after finishing the treatment. It is necessary. It will include food restrictions and also other habitual restrictions.